my name is Gabriela Perez and I'll be talking about Datura and its hallucinogenic effects. Firstly, I'll be talking about the background of Datura. Datura comes with a shell that is spiky and has seeds inside them. It is commonly known to be highly poisonous all around. And in the 19th century, it was sold in pharmacies as asthma cigarettes, since the plant contains tropamine alkaloids that relaxes the lungs, and it was used as medicine. They were eventually taken off the market because of the therapeutic window, and it was too narrow. The dose needed to stop an asthma attack was way too close to the dose that caused toxic delirium and cardiac issues. The textbook gave a case study about a 15-year-old boy who was brought to the ER after he was found mumbling and picking at the air for objects that weren't there. When doctors checked on him, his pupils were dilated and his mouth was dry, which is classic signs of the plant's toxin blocking his receptors. This shows that the drug caused a true delirium, where the drug can't tell what is real and what is a hallucination. For this section, I'll be talking about pharmacokinetics. First, we will talk about route of administration. The most common route of administration is oral, by eating the seeds or by drinking the tea. The drug is absorbed in the stomach in small intestines, with an onset of about 30 to 60 minutes. However, the bioavailability is significantly reduced by first-pass metabolism. For distribution, the drug has a high lipid solubility, which allows it to easily cross the blood-brain barrier and cause those intense central nervous system effects. Next, we will talk about absorption. Because the tropamine alkaloids are bases, they are poorly absorbed in the highly acidic environment of the stomach. Instead, most absorption occurs in the small intestines where the pH is higher. The structures are highly lipophilic, which allows them to cross the cell membrane via passive diffusion. One interesting to note is that the molecules are actually inhibit the smooth muscle of the stomach, causing delayed gastric emptying, meaning the drug slows down its own absorption rate. Next, I'll be talking about metabolism. The primary organ for metabolism is the liver. The metabolic process is primary hydrolysis. The first pass effect, significant portion of the drug is metabolized by the liver immediately after oral absorption. The half-life is typically 2 to 4 hours through cognitive effects that last much longer, such as up to 48 hours. In the excretion, approximately 50% excreted and changed in the urine, the rest as metabolites. Next, I'll be talking about the mechanisms of action. Datura alkaloids are competitive antagonists. As we know, competitive antagonist is the molecular blocker, and it binds to a receptor that does not activate it, so it competes with the natural neurotransmitters for the spot. These tropamine alkaloids inhibit nicotinic and muscarinic receptors, which are the two types of receptors of acetylcholine. Muscarinic receptors are found in central nervous system and the parasympathetic nervous system. When Datura blocks it, it shuts down the rest and digest signals, which is why we see the dilated pupils and dry mouth and fast heart rate. Nicotinic receptors are ionotropic receptors, meaning they act as ion channels. While Datura affects these two, the intense hallucinations and true delirium are primarily driven by the blockage of the muscarinic receptors in the brain. Next, I'll be talking about the behavioral effects of Datura. This image provided was from a 2023 study that tested Datura exposure over 28 days and behavioral effects. In this study, researchers found that Datura exposure produced significant cognitive deficiency, anxiety, and depressive-like behavior. In depressive-like behavior, the study found that there was a significant increase in mobility time in both suspension and swim tests. When an animal stops struggling, it indicates a state of behavioral despair or the central nervous system depression. The study also talked about social impact and cognitive deficiencies. In social impact, there was a reduction in sociability index. As the dose increased, the desire to interact with others dropped significantly. And in cognitive deficiencies, it showed that Datura exposure produced clear memory impairment, measured by errors in maze tests. Finally, we will be talking about chronic use. There are two factors that are associated with chronic use: physical dependence and abuse potential. For physical dependence, we have to look at two things: tolerance and withdrawal. Intolerance, it can be developed with repeated drug use. A 2019 case study followed a patient who was regularly consuming 50 to 70 Datura seeds every single day. Normally, that dose would send someone to the ER with dilated pupils and severe delirium. But this patient showed none of those acute poisoning symptoms because his receptors became less sensitive to the drug. With withdrawal, researchers thought for a long time Datura did not cause withdrawal, since people rarely used it repeatedly. However, research found that it was not the case. In a 2025 article, they found that Datura can be threatening to people who are developing withdrawal. These include depressive episodes, irritability, and headaches. So yes, physical dependence is possible with long-term high-dose use. For abuse potential, Datura is dysphoric, so it means that most users feel confused, terrified, physically uncomfortable, and mentally out of control. And because Datura is neurotoxic, it causes actual physical damage to the hippocampus and prefrontal cortex, the brain areas responsible for memory and reality processing. Abuse potential is low for the general population, but there are few who become chronic users.